The next exercise we're going to perform is a self-manual therapy of the spiral line of muscles, which again are musculature that allows us to be able to rotate our body. And the muscle of that line we're going to work on today is what's called the oblique musculature. So just to give a little bit of anatomical reference, the oblique musculature is the muscles that go and start at the ribs and go across and down towards the opposite side of the pelvis, which allows us to rotate our spine and be able to perform rotary movements. So if we want to be able to go and work on those muscles, we're going to go ahead and utilize a golf ball. And I'm just going to show this by laying down on the table. And what we want to work on is the muscles of the obliques. They start connecting to our ribs and they go diagonally across down to the opposite side of the pelvis. So what we can utilize is something like a golf ball to be able to go and help with being able to improve our strength with this, so that way we're not wearing our hands out. So if I were to go and show this, is that we want to be able to start off over at the ribs and go and do work of manual therapy going across and down to the opposite side of the pelvis. So what I'm going to do is to utilize this golf ball starting at the ribs at the attachment point. So I start as posterior as I can get. It's kind of hard to reach back there. And pushing around, and this is a good manual therapy to go and work on the attachment points for the obliques. So as I push from front to back, this is the way that our obliques usually run. The fibers of the muscle usually run. If I want to make it harder, I would go against those fibers and push front to back. And this might be a little bit more sore. So we do about 6 to 8 strokes, and now when we go and utilize this, you might want to utilize some type of oil, like coconut oil, to put on the skin, so that way you don't irritate your skin too much. So once we've worked on the origin up at the ribs, we're going to work on the insertion of the muscle down in the pelvis. So at the pelvis, it's going to attach right on the pelvic bone. So the pelvic bone, you can kind of feel this on yourself, and you feel where it starts to round towards the top of the pelvis. And right at the top of the pelvis here is where these attachment points are located. So we can utilize our golf ball along the pelvis to be able to reach those attachment points. So again, we want to work both the origin and the insertion points of this. So about 6 to 8 strokes. Along that section. And that should go and be able to release some of that musculature. So this has been the self-manual therapy of the obliques utilizing a golf ball.